a mock interview session as if you're interviewing with a program director. Every year it became a tradition that I do a mock interview session with a residency applicant to show you how the interview looks like, how the program directors ask questions, and then in the second half of the session I give the applicant feedback about their performance so you and them can learn from this experience. So I want to thank you, Nalda, for doing this with us so all residency applicants for Match 2026 can benefit from this experience. Welcome, Nalda, to the channel.
Thank you so much, Dr. Assad, for having me. It's an honor and privilege to be here.
Thank you for taking the time. So the way we're going to do this is exactly like we do our interview prep sessions with our advisors. The way we do this is half of the session goes to questions as if you're interviewing with a program director. So don't interrupt the flow of the session. Imagine, you have to answer the question. Don't ask any questions during this. It's totally fine to take notes or notes about questions you want to ask, because we want to keep the flow of an interview as if it was with a program director. And then I'm going to be taking notes about your answers during this first half an hour. And then afterwards, I'm going to give you detailed feedback about each of the questions you answered. We're going to be overcritical because we want to prepare you as much as possible for the interview. So don't take it personal. We're just trying to improve your performance so you can ace it on the real interview.
Wonderful. Sounds great. Thank you so much, Dr. Assad.
And before we get started, for Match 2026 applicants, we have phenomenal interview preparation resources. Make sure to check them out by clicking the link I'll leave in the description below. You'll get a list of over 200 residency interview questions you will encounter on your residency interviews, in addition to sample answers to these questions. And multiple additional interview prep resources you will find extremely valuable when you're preparing for your interviews. And now, let's get started. Hello, Yunalda. Very nice to meet you.
Hello, Dr. Assad. The pleasure is mine.
So I welcome you to our program. It's a privilege to have you here. I would like to start by asking you, tell me a little bit about yourself.
I am Yunalda. I am 31 years old. I was born and raised in Cape Verde, a group of islands in Atlantic Ocean, close to Canary Island. I moved when I was 18 years old to Argentina. I had to transition to Portugal to get my visa. I lived there for 1 month. And I started my medical degree in 2013. I completed in 2023. I had a gap year during that time. And so the medical school in Argentina is 7 years in total. And so it has been 2 years since I graduated from medical school. It has been, it molded me to the person I am today. It was a Christian education. I was far away from home. So today I am married, 5 years married with an American citizen. I am American citizen. I have 8-month-old baby, my firstborn. So this is basically a little bit of who I am, and I am now pursuing a dream of becoming a doctor in the United States. And yeah, the first female doctor in my family.
That's awesome. That's very impressive. Now I want to ask you, what made you want to pursue family medicine?
What made me pursue family medicine is because I had this desire in my heart in late in the childhood, and then it reassured as I went to Argentina. I applied and I got into medical school. Throughout my journey, I felt it was a calling, and the confirmation came after I came here in the United States, and during my volunteering. Mentorship under one of the greatest family physician I've met, Dr. Robinson. So under his mentorship, I even felt more passion for this career, family medicine. I felt so much inspired to follow this path.
That's awesome. And what made you want to do it in the US?
Well, as I said, my journey started in Cape Verde, and I went to Argentina. But later on in 2016, I met my husband, that we got married in 2020. That brought me into the United States, since he has his roots in the United States. And so after coming here, I felt an obligation per se. I pursue medical degree, convalidate my medical degree from Argentina here in US. So yeah, basically by being married to someone that is American, I felt that I needed to go down that route. I needed to convalidate here in US too.
Cool. And there are multiple programs you can apply to. What made you want to apply to our program specifically?
So your program aligns with the values I have. One of them is, for example, community-based. So that's the area of my expertise. And also I see that you guys have research program as well. Something that I have some experience on it, and also it's overall the holistic care you guys provide is something that I also align with. So that's why your program I see as one of the perfect fit for me. It aligns with my values.
Nice. And on the same page, we get hundreds, if not thousands, of applications actually each year, and we interview a few hundreds of these. What do you think you have that would make us want to pick you over other applicants? What makes you stand out from the crowd?
That's a very good question. I I honestly, I'm not sure if you ever came across with someone that have my background from Cape Verde. There's no much of us out there. As a matter of fact, I'm the only one that studied in a, in that university. I was the only one from with my background, and so I speak 4 languages, and so I'm ready to come into an environment where I can share my experiences with people from different background. I'm pretty sure there's so many great people with great experience out there. So my experience is unique, and I'm looking forward for this opportunity to be able to complete to contribute with the team.
Any weaknesses you would like to improve on?
Weaknesses. That's a very good question. So I think I am in a progress in progress. When I start this journey, I had so much weakness regarding the language. For example, I couldn't express myself in English, and today I did a huge improvement. As a matter of fact, I'm able to establish this conversation with you right now to communicate, and I think there's much more to improve. Regarding my weakness, I think I would say that's a good question. I think I would just like to be better as a student, more disciplined, and time is my weakness. To be honest, I would like to probably be more like disciplined on that matter. So that's one of the thing I would like to improve.
Okay, awesome. And where do you see yourself in the next 5 to 10 years after you finish your residency?
Oh, after 5 to 10 years, I see myself in a hospital, community-based hospital, serving a multicultural multicultural setting, in a hospital with a multicultural setting, and immigrants, and also teaching hospital where I can also collaborate on that matter, collaborate in the educational part. And yeah.
Okay, that's fine. Now we're gonna ask you a few behavioral questions, just to see how you react or have reacted in the past to these kind of situations. Now, tell
Okay.
me a little bit about a situation where you had to deal with a difficult patient, and what did you do when dealing with that?
Difficult. I actually had an experience like that in the past, and the best approach would be act keep yourself together, per se, self-control. So we are basically we are in the highest role, so we need to set up the example to them. They came from different backgrounds, a lot of stress. The sickness can make that them mad. So I would probably be understanding, and but at the same time provide tranquility and address the need of the patient without compromising the well-being of the surrounding.
Okay, give me an example of a situation where you had a misunderstanding or conflict with another med student, with a resident, with a fellow, with a faculty, any of these, and how did you handle that?
During my rotation I think I came across with different personalities, and I remember one particularly. She was from a different country, and in the beginning we were not understanding each other because lack of communication. Of course, none of us English wasn't our first language. It was just a matter of approaching humbly, always humbly approaching and understand from her stand of view what was going on, and so listening. So I think it's a very important communication and listening to be able to have a healthy relationship and in any kind of environment.
Okay, awesome. Do you have any questions for me?
So I would like to know how much independency a PGY one would have in the first year of residency in
So
your.
we have the model of graduated autonomy. So we give residents autonomy as they can show us that they can handle these things. So we usually start people. We have them connected, or there would be also PGY 2 or 3 on their service, and they will start assigning them tasks based on how comfortable they are. Start with like 2 or 3 patients, have them present them, and if you're able to manage that, we go to 4 and 5, and then PGY 2 and 3 more to independent management of these patients, and then you can report directly to the attendings. So it's gonna depend on how comfortable you are, the structure of the rotation, and who you are with as well.
Wow, interesting. And I saw in the website that your program, for example, offer the opportunity to do some community based work. So how that would prepare, what is your plan for the next 5 years with the new residents that come?
Regarding rotation,
Yeah, the community based.
actually, we have a plan to expand these rotations because we saw a huge affinity from applicants who apply to our program for these community type rotations, and we're planning to increase at least 2 to 3 months of these community rotations. So now we do around a year. We're planning to expand that to a year and 2 to 3 months because people have been asking for that, and that can show you how our program is receptive to feedback and improving things based on what residents are looking for.
Oh, nice. Lovely. Yeah. I like the way how you guys involve the residents and are preparing for the future.
Well, thank you so much for interviewing with us. It was a pleasure meeting you.
Pleasure is mine. Thank you so much.
Awesome. Okay. So now let's go into the feedback. That's where the money is. That's where, and I might be overcritical again, and that's what our advisors do during the sessions is to make sure you're very well prepared. Applicants need to know, this is the number one tip. Applicants need to know once you get an interview, the ball is in your court. Now, number 1 and 2 and 3 and 4 is your interview performance. And that I see huge possibility for improvement in your situation. So, and that's great. Why? Because you can benefit from this.
Okay.
And I can tell you that almost all IMGs, regardless of how high their score is and how confident they seem, all would benefit from interview preparation. Even me, when I was interviewing, I would have benefited from interview preparation. So again, especially international graduates, there is a huge potential for improvement. So why waste that opportunity where you can increase your chances of matching by 20, 30, 40, 50%? Sometimes it's like 1,000%. We've seen applicants where if they interview the same way when we started with them, they would not match. And then they would go on and match, amazingly, because now they're presenting themselves in a different manner. Also, that I don't know about you, but for me, when I came from Syria, I never interviewed for a job. You go directly into med school based on your score and residency based on score, and you never get to interview. While American applicants, on the other hand, they interview to get into college, they interview to get into med school, and now this is the third time, and many of them have had jobs and interviews for that. So it's kind of a different beast. But even US applicants could benefit from interview preparation. Why? Because the things that people look for on the residency interview side is different than med school and college. And we have at the Match Guy a list of advisors, IMGs, and US grads, both from allopathic schools and DO schools that are ready to help you. We have over 80 advisors now, and you can get to pick who you want to work with. So that's the advantage of our interview prep service. And the other amazing thing that does not exist in other companies is that if you don't like the session after the first hour, we'll actually give you your money back. So that's how much we trust the value we give to you. So I want to go one by one, and this is how our session goes. After we give you 15, 20, sometimes 30 minutes, but we try to tailor it so we can leave enough time for the feedback. I'm going to go through one question at a time and comment on that and see if you have any questions. So I'm going to start with the overall tone of the interview. I got a nice vibe. I'm having somebody who's nice. I'm getting a nice smile, not too much. There is some lack of confidence that we can work on, but overall, I think if an applicant interviews with this personality, they would leave a positive impression from the personality side. I'm getting a nice vibe that you are a nice person. This is what I can get from the 15 minutes I interviewed you. Now, things that, again, on the general spectrum is increased confidence, preparation for certain points, and discussion points. Many of the questions, and you'll see that's a theme in the answers and the feedback I'm going to give you, is there was no essence to this answer. There was no real discussion points that we're talking about that we can take it from there and get a real 1, 2, 3 of what did she tell me from this? I get 1, 2, 3. I didn't get that from multiple questions. It was just moving around and not giving a real answer. I think if you're doing a virtual interview, some programs probably would be virtual, some programs might be in person. The virtual interview, from that standpoint, I like it's a nice background. Yeah, you have a nice painting, you have your piano. I don't know, I might ask you a question about that. I didn't, but somebody might ask you a question about that. It's not distracting. Always be mindful about light. Light should not be in your background. The light should not be coming in the face of the person interviewing you. It should be on your face. So if you're interviewing with somebody and the camera is there, the window or the sun should be hitting your face, so it lights up your face, not coming from the background blinding the person talking to you. So just be mindful about that. Generally, I prefer artificial lighting, because in that case you're not fully bright, and if a cloud comes in, you're dark now. So get one of these nice umbrellas or ring lights from Amazon, and you would be fine with that. Camera, there's multiple cheap options. You don't have to go with something extremely expensive. Any camera that gives a decent audio video quality would be good. So from that aspect, I think you have a good background. One thing you might consider is adding a plant or something like that, or a discussion point, like something you want to add that you want people to ask you about, so you can bring up a discussion point.
Well, how about the lightning? This lightning, is it okay?
The lighting is really good. Yeah, I like it a lot actually. So it's giving a nice reflection on your face. I think you did a great job with that. One thing we noticed before the interview, the closet was open, so we had to close it. So just be mindful about these things, because in the beginning, the camera, when we were recording, only showed like portion of the picture, but when we expanded, the whole thing was visible. So be mindful. There is no bed that is not clean or organized or a closet open. So just be mindful about these things. Now I want to go into each of the questions. And let's start with tell me about yourself. That's probably the most important question you're going to get on a residency interview. It will show up on every interview. I don't remember a single interview that did not start with tell me about yourself. And that's how I interview even people who work for me. I want to know who they are. Just have them summarize their life story to me. And for you, I'm going to give you some points you mentioned to me. You started with 31-year-old. People do not care about your age really. If they want to measure that and calculate that, they can go to your ERAS and subtract your date of birth from the 2025. But people don't really care about that. You had so many details and things that didn't really matter. You mentioned the gap year. You're telling them about your red flags without them asking you about that. So there is no point in telling them about the gap year. You mentioned Christian education. I don't know, was that something you wanted to tell them about? Are you trying to have them connect with that, or not? Just something that you mentioned that is it something that really matters to you, that you really want to mention, or not? So that just things to keep in mind. It's not right or wrong here, but it's just how you want to present yourself. And then you mentioned the married to American citizen multiple times. Again, I don't know if you're trying to say that I don't need visa, or you're just mentioning it as part of the story. So, you can see that I like to analyze everything to the next level. I probably more than what a regular program director would do, or an interviewer would do. But because if I prepare you with that level, and our advisors do that, you'll be ready for an interview. So let me take a step back and tell you what you should say and tell me about yourself. Tell me about yourself. You have 1.5 to 2 minutes max, maybe between 1 to 2 minutes. I would generally err on the 1.5 minutes, so 1 minute 30 seconds, to sell yourself. This is your opportunity to tell me why should I pick you. So every story, every point should be extremely well thought out and discussed and decided on. It's not just, let's talk a little bit about each other, and tell you where I grew up and who I got married to. I need things that matter and would sell you. So I would start when I started, when I was interviewing, I would start actually with thanking them for interviewing me. I always do that. I think it just builds an initial appreciation for being there. Thank you, Dr. Assad, for interviewing me. I'm very excited to be here.
Forgot that part.
So you got that part, but I'm just reminding applicants to thank people, to thank the person for being here and for inviting them for the interview. It literally takes 2 seconds. It shows appreciation. It just sets the tone in a different place. My name is Malki Assad. I'm originally from Syria, and I'm saying that because I want them to know about my background. I'm not just telling them a life story. I used to say I'm from Aleppo, one of the oldest cities in the world. I'm establishing connection to history, connection to culture, bringing diversity to the program. So for me, Yolanda, every single thing I say on my residency interview has a connection to something. It's not just random selection. I have thought about my interview answers for days. So tell me about yourself. Yolanda, I wrote a list of 2 pages of points I can mention in my residency interview. And then I picked and chose of which ones do I fit in the 1.5 minutes that would present me the best version of me. And for applicants watching this video, I actually have another multiple videos with our advisors. I'm doing this exact same thing with an advisor and them providing an excellent answer, and we're commenting on these answers, and you can watch these videos. I'll leave the link for them in the description of this video, so you can see how an excellent answer looks like for the tell me about yourself, for all these questions I asked Yonalda today. But today I want to give you comments so you can see if something went wrong, what was the reason, so you can start seeing the compare and contrast. So again, I made a huge list of multiple things: my research, my rotations, my cultural background, me ranking high in my high school in Syria or my med school in Syria, me getting this award here, me getting that award in research, me applying to grants. A big, huge list. But then I have to collect that into a small list so I can present it and tell me about yourself. Otherwise, you'd be talking about yourself for 5 minutes. So, and then you have to blend it in a story. So every point has to fit into that personality you're trying to present, that applicant you're trying to present. And remember, they might not ask you about your research that you did. They might not ask you about your experiences and rotations. Don't be surprised if some programs didn't even look at your application. Some people don't have time to review applications and they invite you solely based on a score. So sometimes the PD reviewed your application, but the faculty interviewing you might have only read your personal statement or just glanced at your CV. So don't assume the people interviewing you know your CV. So that is your opportunity to tell them your name, where you came from if you're from outside the US, anything that would interest them, that might connect with them. And then if you're an IMG, I want to know answers to certain questions. Are you good? Are you going to be good clinically in the US? Have you done rotations here? You need to answer that question for me before I even ask you. Have you done research, if any? Is that important to the program? And that brings me to my next point, which is, do you change your answer based on the program? And the answer is yes, you do change your answer based on the program. Because if community program, like this one that we assume that this is a community program, will not care too much about research. So if you've done so much research, maybe don't spend so much time talking about that here. Focus more on the clinical aspect. If you're interviewing with Harvard, they care a lot about research. So you need to present yourself how you'll become the next leader in IM or FM or whatever specialty you're applying to. So your answer will also change based on the faculty you're interviewing. If you interview somebody who grew up in Rochester, Minnesota, and you did research at the Mayo Clinic, you need to bring that up because that established the connection immediately with that interviewer. If you visited that city, for a conference, mention it because that will establish the connection and become a discussion point. So that shows you, that it's not just about, I prepare an answer, cookie cut approach, and I just present it to everybody. Also practice. So you formulated these points you want to talk about. I personally did not write a script for each answer. I more made it in a way that I have bullet points and I review them before every interview. How do I want to present myself in these commonly asked questions? And I take it from there. I try to make it more natural. And you will remember these bullet points. Because if you write a script, it's going to seem so robotic and you will probably forget things and you'll just not know what to say in the actual interview. So I recommend you do it more of a bullet point style, and that is something advisors can talk to you about, what is important. Does mentioning the age matter? You might not know the answer to that, and an advisor can help you with that. So again, tell me about yourself. The most important question, you need to present yourself in the best way possible. Talk about your rotations, talk about your research, talk about your background, and fun facts about you. That presents you as strong, very strong, and fit to this residency program. Any questions about that, Yonalda?
So from everything I said about in telling about myself, it was, and besides the age, is there was relevant the things I said, anything that wasn't relevant that I mentioned?
I think the gap is something you should definitely not mention.
Okay.
I did not learn about you from are you a strong applicant? That answer was not obvious to me. So have you done rotations in the US?
Yes.
So you could have mentioned that, and Mention it from like a strength point. I want to learn more about the system, and that's why I spent. And you again, you don't need to present it as a CV. It has to be more like flowing with the story. I spent 3 months in the US, and that emphasized my interest in pursuing residency in here. I was very impressed by, I was working with family medicine physicians and them taking care of patients, and seeing that relationship with them emphasize my interest to pursue family medicine. So I'm just, I'm not preparing an answer now, but I'm just giving you thoughts of how this could be blended in a story rather than I did research at this place, I did rotation at that place. No, it has to be kind of a story
Flowing,
in a concise
connecting.
manner. Exactly. Exactly. Now let's move on to the next question. So I asked you about family medicine, and this is another common question you'll be asked about, in your residency interview. Why are you interested in this, whatever specialty you are pursuing? And that answer needs to have experiences.